Okay, so drugs. There's a concept that I think it's a little bit simplistic, but it's a useful tool for me anyway, which is that there are two major issues with delirium. One is dopamine excess. Dopamine contributes to a lot of the positive symptoms of delirium. So again, the hallucinations, the delusions, the agitation, the hyper alertness. Those things will often respond very well to anti-dopaminergic medications like haloperidol. But that doesn't do nearly as much to fix the negative symptoms of delirium. And acetylcholine deficiency is probably a large part of what contributes to the negative symptoms. They don't have enough of that, so they're not going to think clearly. They're not going to be paying attention. They're going to be kind of dazing out, not in and out of sleep and drowsy. So, okay. I just showed that, so that's fine. I was asking, well, the next question is, what are some of the main medications that contribute to delirium, that can cause delirium? This might give you a clue for some of them, but by no means all. Come on, touch them out. What causes delirium?
The anticholinergic, which
very good.
On the screen.
Can I give an example of an anticholinergic?
Like the Parkinson's meds.
Well, that would actually be a dopaminergic medication. Okay. Anyone else have anticholinergic medications? I'll give you a list in a minute. I'm just curious if that means anything to people. Okay. Anyone else have any other medications that cause delirium? Come on, you guys have all seen medications that cause delirium.
Something that medication that stops the stomach cramping.
Thinking Lepsin or Bentyl or something like that. Phenergan. Ding, 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 ding. Phenergan is absolutely correct. That is anticholinergic and antihistaminic and very much causes delirium. What else? Come on. Reglan might. It's less of an issue, but it could. That's more of an anti-dopaminergic, so it's less of an issue. Okay. You guys all fail. No. That means I needed to do this talk. This is key. So anticholinergic medications are key, and I'll give you a list in a minute of one or two of them. These are key. Benzodiazepines, use or withdrawal. Okay, Ativan, in my experience, is perhaps number one villain as far as this goes. That's a little simplistic, but it can cause it when they're on it, and it can cause it if they stop it suddenly. So we don't want to. We had one patient who had significant issues with medication misuse, and she had been on another hospice, and she ended up getting up to 4 milligrams of Xanax 4 times a day, and they ended up realizing, you know what, this isn't helping her, and so they stopped it and put her on Haldol instead. Apparently that was pretty hellish 5 days, and fortunately she survived, because that can kill people if you stop benzos suddenly in cold turkey like that. We do, so withdrawal from them, they hit the same receptors as alcohol does. So if you think about alcohol, yeah, it may help calm you down, it may help you sleep, but it's not going to clear up your mind. You're not going to think more clearly after you had a few drinks, and you're not going to think more clearly after you've had an Ativan. We see reactions in I see reactions in two ways from this. There are some people who get an immediate paradoxical reaction. You give this to them, they get angry, they get agitated, they're fighting. We tried to do palliative sedation with a benzodiazepine on someone who had that happen, and that was who had that reaction. And that was not the wisest idea, but that is relatively uncommon. Much more common is, yes, it works for them. They go to sleep, or they're really calm and relaxed, but then they're waking up again. But they're in that twilight state. They're confused. They're really drowsy. They're not really with it. They're cloudy, and so then they're more confused, more difficult to deal with. And so what you end up doing is you give them more because, oh yes, it helped. It worked for a few hours. So, but then they're worse when they come out of it. So you give them more, and it ends up being basically an unintentional form of palliative sedation. So benzos are a huge villain in my mind. Opiates can, unquestionably, and they can do it in two ways, one of which is just some people will get it even at low doses of an opiate. The other one is something we'll talk about later with opiate neurotoxicity. Antibiotics. This is a big one, interestingly. And unfortunately, some of the ones that we use quite regularly are major villains here. Quinolones, Levaquin, cephalosporins, a lot of them. I've seen several cases where someone got put on an antibiotic for a UTI, which is almost certainly causing a delirium, and then their delirium gets worse. Okay, what's going on? Well, and then it's not until they stop it that it gets better. We actually had one a month or two ago where I gave Lisa a gold star for figuring out what the problem was, which was Bactrim in that case. That was not one I tend to think of as much as a villain, but it was clearly temporally associated, and when we stopped it, it went away. Parkinsonian medications can cause some of the more active symptoms because, again, they are dopaminergic medications. There are a lot of other medications out there, including over-the-counter medications and herbal medications. So keep that in mind. Just because it's not something we're prescribing doesn't mean it's not something they're taking. And here is a list of one or two anticholinergic medications. Over here in particular, these are the ones that we actually use for specifically their anticholinergic properties. Atropine, anything that dries up any part of the gut or slows down part of the gut or decreases cramping, we're using for its anticholinergic effect. So anything we're using to dry people up, anything that helps any kind of cramping, really, any kind of smooth muscle cramping in particular. Lavsin, Ditropan and Detrol for bladder spasms. And Robenal can, but Robenal doesn't really cross the blood-brain barrier to any significant degree, which is one reason I do like Robenal more. That's glycopyrrolate, meclizine. Antihistamines are huge. A lot of these are anticholinergic. So almost, people take Benadryl over the counter. We had one not too long ago that, got on Benadryl and went delirious. Okay, well, that's not, those are major villains. Anything that's going to affect the brain in many ways almost can do this. These I don't think of as much, except that, interestingly, Thorazine is antidopaminergic and somewhat anticholinergic. So it blocks the positive effect of the positive parts of delirium, the more overactive states and the hallucinations, but it actually can worsen their thinking. I had one doctor who said it makes people stupid. One psychiatrist I work with, and so it's something we use some, particularly at night, because it's not as big a deal if they're stupid when they're asleep at night, but it is highly sedating, which can be an anticholinergic effect.
What is cholinergic? What is
I'm
that
sorry,
cholinergic?
acetylcholine is, actually we're talking specifically antimuscarinic anticholinergic, because there's various different things, as opposed to anti-nicotinic. But in any case, acetylcholine is a neurotransmitter. And it's in various things, including in the brain, and there's certain types of receptors that it acts on, and so it is dopamine and acetylcholine are both neurotransmitters in the brain that help carry messages in meaning different things. There's others, serotonin, we talk about with some of the depression medications, norepinephrine, a variety of others, but that's what it is, and things that block that.
All of those are under anticholinergic.
All of these have anticholinergic properties. Some of them are primarily anticholinergic. Some of them, it's more of a secondary effect. But yes, it is a very, very common thing. They all have these effects, and so almost any of these may cause, among other things, not only delirium, but dry mouth, it may cause drowsiness, it may cause constipation, urinary retention. So all these things are problems. Amitriptyline is a big one. Nortriptyline is less so, and so that's one of the reasons I prefer nortriptyline to amitriptyline.
Donatol. That's the word I was trying to come up with.
Okay.
Isn't that an anticholinergic? That old drug?
I'm trying to remember Donatol. I know it's in those medicines, but it wouldn't surprise me. I honestly do not remember what type of medicine that is.
Sorry,
That's a good
just
question.
had to come in.
That's I know that's in GI cocktail, but that's the only way I've ever seen it, so I'm sorry. But certainly any of these can help with spasms, so yes.